These are extrinsic risk factors or modifiable risk factors for central line associated bloodstream infections. Patients that have a prolonged hospital stay before the central line insertion are at increased risk. People that have multiple central lines, so if you can condense your medications into one central line, that's advantageous. Patients undergoing parenteral nutrition, so if enteral nutrition is an option for your patient, that's also an advantage for infection. Femoral central lines are worse than other central lines, worse than subclavian, worse than internal jugular central lines. That being said, subclavian central lines, which have the least infection risk, have their own issues like pneumothorax and bleeding risk because the clavicle prevents application of pressure in case there is a bleed. Heavy microbial colonization at the insertion site, such as a surgical or wound site, also predisposes to infection. Multilumen central lines tend to be worse, and lack of maximum sterile barriers for central lines. So you should always use barrier protection like a large drape, sterile gloves, gowns, masks, and caps. Central lines placed in an ICU or emergency department tend to do worse than operating room.